like a song. It's beautiful.
Sing-songy. All right, everybody. It is Thursday, April 1st. We're not fooling you today. We've got some great content here. My name is Heather Cox with my dear friend.
Hey, everybody. This is Stephanie Stevens. Glad to have you here at MS Office Hours, and glad to welcome today our friends from ECare Vault, who are going to take us on a little journey of understanding and knowledge. And hopefully by the end, you'll be able to see the vision that we've been able to get just in a few short weeks of knowing folks and working and seeing ECare Vault. I think it'll be a really great piece of information for you, a great tool, a great solution for a gap that we know is forming even deeper after the last year that we've all lived through. So excited to turn it over to Stephen and Aparna.
All right.
Thank you very much. Pleasure to be here. My name is Stephen Simmons. I'm the Director of Client Solutions here at ECare Vault. With me is our founder and CEO, Aparna. And we're happy to walk you through a lot of the stuff focused around, how we can drive cross-setting collaboration for student mental health and learning support through safe spaces and Microsoft Teams. So I'm going to start sharing my screen, but Aparna, would you like to share more and introduce yourself?
Sure. Hello, everybody, and welcome to MS Office Hour. Thank you for having us. We're so excited to be part of the Microsoft family, and I think what I'd love to do is really share my experiences as a user, an educator, and a service provider in both K-12 and higher ed around taking care of our students and staff around mental health and learning lags. Really, I'm the CEO and founder, and really, ECare Vault began as a simple idea, really, to break down care silos that continue to exist between the different services that a student or a staff member receives across different settings. And very often what we find is these different settings don't talk to each other. And now we're so excited to harness the power of the entire Microsoft 365 platform, really, to bring out the human element out of teams. So very quickly, I think if we think of teams as productivity, and we just got off that awesome office hour with some of the productivity related questions, now we get to think about the individual, because guess what? So much about productivity is if you can't look after the individual, you can't look after the company or the enterprise. So here we are with ECare Vault, and if you, Steve, if you want to just take me through some of the slides. So very quickly, in mental health, one of the things that is sometimes understated is that the individual exists in the context of society. So very often, we think of mental health as a sort of siloed system, which it isn't in the brain. It affects availability to learn, your interpersonal relationships, your organizational relationships and productivity, your connection to community and society, your risk to harm or to be harmed, all related to that. So when you think of children and youth, we're thinking, EDU, we're thinking HHS, human health services, we're also thinking, justice and public safety. And so it's really that interconnected system with the individual in the center. And one of the ways I like to think about mental health is, it's probably just because I'm a bit of a fitness buff here, is like, it's really like physical fitness. With physical fitness, you think of sort of that stamina, and that ability to sustain performance, to have peak performance, and to be in that zone. It's the same thing with mental health. Mental health is to fitness, the stamina is the availability to learn. And I think it's so important, and then we're going to find this, especially now with COVID-19, sort of really brought it to the fore that unless we take care of mental health, we can't take care of sort of that availability and engagement to learn. And I don't want to go through these stats. I just want to keep this conversational and leave enough time for QA. But I think the biggest point here is that it sometimes goes unnoticed that mental health has a substantial onset in childhood, which means that most kids, if they're going to develop mental health later on, they already have it. which means that a lot of these kids are, it's not only pervasive, but it's also undertreated. And it's something staggering, like 50% of all significant mental health issues begin before the age of 14. And in higher ed, when we think of enrollment, matriculation, and retention of these students, one of the things we find is it's anxiety and depression is super underreported. And more importantly, that was sort of the most startling thing for me, is that a big percent do not actually seek help, which is huge. That a big percentage, I think it's about 40% only actually seek help for their issues. And that's traditionally because learning has been siloed and mental health has been siloed as we began. And I think now, whether we like it or not, educators in both K-12 and higher ed are needing to take on that augmented responsibility of taking care of the mental health of the students so that they can be available to learn. And then this is what I'm calling the backpack tsunami. Get ready, folks. It's coming, like big time. It's coming. Fall 2021, when these kids in K-12 come in through their backpacks, and as well as in higher ed, all those stats we showed you was actually 2019, 2020, even before the pandemic hit. So now imagine, I mean, we're talking of a force multiplier effect here. And there are really three pillars we think of it in. One is that student mental health is just going to be worse. So there are going to be all these parents, especially in K-12, saying, okay, we need to trigger a core evaluation. We need a screening. We need a care plan. It doesn't mean this kid has a special ed need, but needs some place to kind of have the screening and a care plan put. Where is it going? Where are we sharing all these, documents, typically paper-based workflows? And Steve is going to talk to it a bit later, that fundamental now, it's not a question of if, but when. We have to digitally transform a lot of these paper-based workflows around mental health screenings and assessments. The second one, learning lag, special education. Again, previously there was mental health and special education. What we see is essentially the need, and this is where I can't wait for Steve to share with you how you can leverage your existing Microsoft Teams instance to really create that case collaboration hub, so that the school can essentially start triaging. And then the third piece here is those socioeconomic factors, which have nothing to do with special needs or mental health. This is just because the economy just got worse and families are being displaced. So that student that doesn't attend and you have an empty seat, it could be because they lost their housing, their parents lost a job, they can't pay funds, and so all those reasons. So really, we need pathways and bridges with the community to get that full intel. So that we can care for the student appropriately. And educators are feeling it too. I mean, we've seen this, that, just 57% of districts, as it says here, huge, teachers and support staff are seeking assistance. They've had to juggle with different aspects. And you can imagine that this is that shadow pandemic that is continuing past current times. And again, this just speaks to the augmented responsibility as educators that we have now and administrators in order to take care of them. And how do you do it in a sort of a scalable way? And that's kind of the key that we get into safe spaces later on. And yeah, so the good news here, and that was sort of the dark side. Here's the light side, which is and this is not just talk. Honestly, this is we're actually living this right now with some real beacon states around the country, where we are working with them actively. ECare Vault and Microsoft are to help them deploy American Rescue Plan dollars into schools in order to build capacity. And then the other piece here is schools cannot do that alone. They should not do that alone. There are community health services out there, outsource agencies out there. And then the question is, fine, great. If you do outsource a service, how do you still have visibility? Because at the end of the day, the buck stops with you as the educator. You are responsibility for the student. So again, the need for that cross-sector collaboration in order to leverage and build capacity through community health organizations. And then the final piece is that it doesn't have to all be phone calls and faxes anymore. We have scalable solutions. We've cracked the nut as a society for what is FERPA compliant and HIPAA compliant. And so you can have both privacy compliant from an education and a healthcare standpoint and be able to, at the end of the day, these were meant to protect consumer safety, not to be barriers for them. Like, yep. And then the final piece before I pass it on to Steve is do please contact us at the end of this sort of conversation, because we can help you and share with you how you can actually leverage some of these American Rescue Plan dollars. I think it's literally written for this. You get to close the digital divide with digital transformation of privacy compliant workflows. So we're talking, for instance, service assignment, service tracking, cost reporting for Medicaid billing. Now, this is not one more system. You can have your IEP system, you can have your student information system, you can have your Medicaid system, but the issue is there are gaps. How do you actually provide the service and actually make sure that you're tracking the service and not get into huge parent litigation risk by making sure that the services that were promised are actually being delivered? And then that's kind of where ECare Vault comes in, by streamlining and making transparent and tracking those workflows with the help of teams through safe spaces. And then the other piece around student mental health and hybrid service delivery, as I said. So all in all, just want to mention that there is funding and there is technology that can be of help. And as domain experts, like we'd like to, we're a motley crew of educators, nurses, special educators, teachers, behavioral health specialists, and technologists, of course, at ECare Vault. And we love what we do, and we're sort of so mission oriented. On to you, Steve.
Thank you, Aparna. It's really great to see that into context and just see some of these statistics that have been showing up and all the different causes and factors of the past year, and how they've kind of elevated things. What I want to discuss is actually what we're doing at ECare Vault, which Aparna kind of did talk about, and how we've leveraged Microsoft Teams to be able to drive cross-setting collaboration around the support of mental health and faculty and student services. So as Aparna kind of touched on during her session, what we're seeing is not only a crisis around mental health, but the resources and solutions that schools have to actually operationalize support for those who need it. At ECare Vault, as a mission-driven company, really, it's our goal to help support these vulnerable students and faculty so they can get the support they need in a team-based collaborative manner. So what we provide really is privacy-compliant collaboration that starts at the enterprise of the school and that can extend into the community and into the home settings as well. And what this does is really creates an interoperable bridge between sites and systems to include all these key stakeholders that are in the community, like these community health organizations, family members, those who need to be there to be updated and within these workflows to help drive that care. So what this connection does is to help drive that continuity of care for mental health and learning supports into the community to help enhance those outcomes and address learning gaps that may have happened over the past year. And what's really awesome and what really we're here to talk about today is our Safe Spaces application for Microsoft Teams. With Safe Spaces, you now have the ability to drive this collaboration and coordination around these different sensitive issues and topics directly from your Teams instance, which is pretty amazing. And what Safe Spaces enables is an out-of-the-box HIPAA and FERPA compliant workspace to be able to include both internal and external stakeholders, as we kind of talked about, within a dedicated forum for sensitive discussions and secure file sharing. We've also leveraged the power of the Azure Bot framework, so Teams users can notify all these different team members across settings to be able to drive time-sensitive collaboration in the support of student mental health, special education, workforce development as well. And really what's super exciting about this is for Teams users, you can now drive this continuity of care with the community in the platform that you use on a daily basis. And one thing, as Aparna kind of touched upon at the beginning of her presentation, is how we kind of bring the human element out of Teams with that persona at the center of kind of everything we do. And to just put a bit of context into what I've talked about so far, I want to share some real life examples of how Safe Spaces can be utilized today within the typical Teams experience. So really this starts as a part of your daily work and what you do in there. For instance, when a conversation in a Teams channel becomes sensitive in nature, say you're discussing things about a student that may contain their protected health information or something like that, you have the ability to pull that conversation directly into Safe Spaces and out of a mainstream channel, that now you can collaborate with peace of mind, knowing that the things that you're sharing and discussing in there are protected and are in compliance with industry regulations like HIPAA and FERPA. Another thing we touched upon is that schools will need to leverage different external resources to help scale to meet the needs of what we are calling the backpack tsunami and the different difficulties that faculty may be facing as well. So what we can do is help drive that coordination between internal resources and community resources to help bring that those services in and collaborate with those outside your organization while maintaining compliance in your team's instance. And then, last but not least, we talked a lot about collaborating with community members, but when you need to include a new member of a team or a new community kind of aspect within a team-based setting, what we can do is help streamline those referrals to community providers in a quick and secure manner. So someone outside your organization will receive an invitation to our core platform, which will then allow them to communicate, sign a digital consent form so they can get to work quickly and provide those services for the student or faculty or whoever they are providing care for. Right now, what I want to do is quickly transition over to a video that kind of really shows and depicts how Safe Spaces works and how it can drive that continuity of care and collaboration around a student who may be exhibiting mental health issues and how they need support from those in a team-based manner. This is kind of focused in a K-12 setting, but obviously the same stuff can apply for higher ed. So yeah, 1 second, I'll just move over to that.
With the Safe Spaces app, you can augment the existing capabilities of Microsoft Teams with an out-of-the-box, privacy-compliant, collaborative workspace to manage sensitive projects. Today, we'll be taking a look at how those that care for an individual or care recipient can drive continuity of care and enhance outcomes within the Safe Spaces app. We'll follow a day in the life of Brandon, a student at the high school, and how his team can help him support him when he is facing issues. To begin, Tegan, a teacher at the high school, is notified by Brandon's learning profile that he is falling behind on his schoolwork and may need some attention. Tegan shares a note to Connor, the school counselor, notifying him that Brandon seems to be facing some issues and asks what can be done to help him. Within Safe Spaces, Connor is notified by the ECare bot that Tegan has sent a new note about Brandon. After receiving the message, he can review the resources and reports on the student he has available directly within the application. He can then connect with Brandon's after-school mentor, Corey, at the community care agency to let him know of the situation that Brandon is facing. This enables Connor to ensure the student's support team is kept aware of situations that are happening at the school in a secure and timely manner. Next, Connor will go to the Documents section, where you can upload and share resources with Corey so he has relevant care context for how Brandon is feeling emotionally. He begins by selecting the Upload button and chooses the documents to share. Connor chooses the team members he wants to share the documents with. This allows him to securely share documents with users outside of his organization, directly from Microsoft Teams. Connor can then meet with Brandon to better understand the issues that he is facing. Here, Brandon expresses how he is feeling overwhelmed with stress between caring for his siblings and his workload at the school. After the meeting with Brandon, Connor can send a message to the student's care team, letting them know about his situation to help ensure that he gets the support he needs across the school, home, and community. This helps to create transparency, accountability, and seamless engagement between all stakeholders on a care recipient's team. Brandon's mother will then receive an alert from ECare Vault that he's had a rough day. She's also received some stress relief techniques from the counselor via Safe Spaces, which she can view on her smartphone. She talks to her son and makes a plan for him to relax at home and cooks his favorite meal. A few weeks later, Connor receives a message from the school resource officer requesting an update on how Brandon is progressing. Connor can respond by saying that Brandon is now getting the assistance he needs and has been excelling in both at school and at home.
Great.
With the Safe Spaces app, you can augment the existing capabilities of Microsoft.
Sorry about that. So, just to close things out, happy to say that Safe Spaces is available in App Stores today. And we're really proud to be able to have this and operationalize it through Microsoft Teams. Of course, if you, if anything's kind of hit a nerve today, or you see, this could really help out what you're doing at your school, please send us an email at safespaces@ecarevault.com. You can take a screenshot now if you want to, contact us. We can help set up your instance within Teams. You can also search for it in AppSource, and I'll give you step-by-step directions on how to, work with your IT systems admin on how to activate it. And for our attendees today, we're, extending a special offer for some limited clients to receive safe spaces in our core ECare Vault platform for no or minimal cost for the rest of the school year and kind of into the summer to help support those who may be needed and test things out, and we'll get you set up for back to school in the fall of 2021. So that's really our presentation. It was a pleasure to be able to talk a little bit more about the really cool stuff we're doing with Microsoft Teams. If there are any questions, Aparna and I would be happy to help answer those.
This was awesome, you guys. Thank you so much for taking some time. I'm just sitting over here. I'm glad my camera was off because I just was almost like having a church moment over here, like, yes, this is great. Okay, yes. And I think anyone who's spent time in a classroom can understand that this is so needed. And we're all coming in a little bit late. So let me see what questions are out there.
I am not seeing any just yet. But while we're waiting for someone, first of all, can you hear me? Because I can't see people's faces. Okay, so my screen is just being funky. The one thing that I will say, and kind of speaking to, like I said, my sweatshirt, mental health is health. I just, having even worked with elementary, just to be able to start, supporting students from the time they start school through the time that they leave school, so what does Dave always say? It's not, he doesn't say K-12. What does he say? K whatever,
K-24, yeah.
K-24 is what he says, yeah. So
cradle to grave, right? Like
to be able to support at all of those levels. I mean, everybody knows things that are going on in the world, and if we certainly can support students in whatever they're needing, and do that in a private, respectful, compliant manner, I think there's so much power to what can be done. So I really appreciate seeing this and learning more about it for sure.
And I just want to make a little bit of a plug here for, I think it can be obvious for us to think about the kids who are most at risk, right? Or the ones that we've already been tracking in a variety of ways, whether it's through IEPs or 504s or SSTs or RTIs, or throw another acronym out there. I think it's really important to consider the idea of a personalized care team as part of a personalized progression for all students, because that's just what's healthy and good. It's certainly a part of how we at Microsoft are envisioning a future of a blockchain comprehensive learner record. It's certainly a part of how personally, my research and area of expertise in personalized learning would say that the emotional and social well-being of a child impacts directly, as we all know, right? Like Maslow's hierarchy directly impacts their ability to academically perform. And so if we're not covering this piece up, then we're not covering up the kids. And that's what we're all here to do. So,
and Stephanie, that's so on point. Like one thing you were just saying about the care pathway, the personalized care pathway, as a clinician, I know that these care pathways are nonlinear, right? It's trauma informed, which means that they kind of regress, and you need feedback loops. And very often, as a school-based educator, both in K-12 and K-24, right? It's just you operate in this silo, and lack of information is lack of intelligence, because then you can't operate. And we're not even, in some sense, not even talking about enhanced outcomes. We're talking about preventing negligent outcomes. The right hand often doesn't know what the left hand's doing. So I think knowing what's happening outside the setting, Brandon was dysregulated because he saw gunshots in the neighborhood, and he comes out completely, and he's not attending. And this idea of positive psychology, knowing that would mean that, hey, there's maybe a little bit of a handle with care, attitude on that day if I knew that adverse event had just happened to Brandon. So
absolutely, yeah. And I think too, just things that might not seem as gravitas as that, right? When she was in second grade, our dog passed away, and my daughter just had a really tough time with it for a long time. And would cry at school and just kind of have moments of sadness. And, it was sort of a moment where the teachers were like, you have to move on, you have to get over this. And it was sort of that stiff upper lip mentality rather than really addressing the underlying sadness and fear and things that come along with death and, just all of that little ones struggle through. But something that I talked to Stephen about when we were kind of speaking ahead of the call was the idea of all of the people who are going back into schools, maybe for the first time in over a year, adults who are going to need also this kind of care and support. And what an amazing employment opportunity to be able to care for your people this way, school district leaders. So an untapped resource for sure. And again, thank you guys so much for being here. Heather, I think we can probably stop the recording and just say our farewells as we end the hour. But again,